Assalamu alaikum wa rahmatullahi wa barakatuh. In this lecture, we will talk about the major arteries and superficial veins of the head and neck. Regarding the carotid system, we have the common carotid arteries, external carotid arteries, and internal carotid arteries. The left common carotid artery arises from the aortic arch, then ascends behind the left sternoclavicular joint to enter the neck. The right common carotid artery begins from the bifurcation of the brachiocephalic artery just behind the right sternoclavicular joint. In the neck, both common carotids ascend in the carotid sheath that contains also the internal jugular vein laterally and the vagus nerve in between and behind. The cervical sympathetic chain ascends posterior to the carotid sheath, not inside it. Both arteries, the right and the left common carotid arteries, terminate by dividing into the external carotid and internal carotid arteries at the level of the upper border of the thyroid cartilage. After bifurcation of the common carotid arteries into internal and external carotid artery, the internal carotid artery at its origin dilated into the carotid sinus. Then it passes in the neck without giving any branches to terminate at the base of the skull by entering into the carotid canal into the petrous part of temporal bone, unlike the external carotid artery, which has many branches in the neck. The external carotid artery at its beginning lies deep to the sternocleidomastoid muscle, but most of its course are superficial in the anterior triangle of the neck, where its pulsations are usually visible as well as palpable. It terminates within the parotid gland by giving at the level of the neck of the mandible by dividing into superficial temporal and maxillary arteries. Other branches of the external carotid artery include the superior thyroid artery that give also the superior laryngeal, the lingual artery that supplies the tongue, the facial artery that hooks around the mandible where it can be felt and ascend on the face, the occipital artery, the posterior auricular artery, the ascending pharyngeal artery, plus the two terminal branches which are the superficial temporal and maxillary arteries. This figure illustrates the root of the neck with the subclavian arteries and their branches. Both subclavian arteries arise behind the corresponding sternoclavicular joints. The left subclavian artery arises from the arch of aorta, but the right subclavian artery arises from the bifurcation of the brachiocephalic artery. Both arteries terminate at the outer border of the first rib by becoming the axillary arteries. Along their courses, the anterior scalene muscle divide each subclavian artery into three parts. The branches of the subclavian artery include the vertebral artery, the thyrocervical trunk that gives the inferior thyroid and inferior thyroid, transverse cervical and suprascapular arteries, the internal thoracic or internal mammary artery, and the costocervical trunk that supplies the deep structures of the neck via the deep cervical and superior intercostal arteries. Now, what are the arteries that supplying the face? The facial arteries include the facial artery, the transverse facial artery, which is a branch of the superficial temporal, in addition to a number of small arteries arise as the terminal branches of the ophthalmic artery and terminal branches of the maxillary artery and the mental artery, which is a branch of the inferior alveolar. The facial artery, which is the main artery that supplies the face, arises from the external carotid artery, ascend to the face along the lower border of the mandible, taking a tortuous course till it reaches the side of the nose, then terminate at the medial angle of the eye as angular artery, which anastomoses with the terminal branches of the ophthalmic arteries. The branches of the facial artery include the superior labial artery, the inferior labial artery, and the lateral nasal artery. Now let's know what are the pulse points of the head and the neck. Arterial pulses can be felt at 4 locations in the head and neck. First, the carotid pulse. The common carotid or external carotid artery can be palpated in the anterior triangle of the neck. This is one of the strongest pulses in the body. The pulse can be obtained either by palpating the common carotid artery posterolateral to the larynx or by palpating the external carotid artery immediately lateral to the pharynx. I mean midway between the superior margin of the thyroid cartilage below and the greater horn of hyoid bone above. The second point is the facial pulse. The facial artery can be palpated as it crosses the inferior border of the mandible immediately adjacent to the anterior margin of the masseter. We have 2 sites for the temporal pulses. We can palpate the superficial temporal artery or its anterior branch. The superficial temporal artery can be palpated anterior to the ear and immediately posterior superior to the position of the temporomandibular joint. The second temporal pulse is to palpate the anterior branch of the superficial temporal artery posterior to the zygomatic process of the frontal bone as it passes lateral to the temporal fascia and into the anterolateral regions of the scalp. In some individuals, pulsations of the superficial temporal artery can be seen through the skin. The superficial veins of the head and the neck include the external jugular veins and the anterior jugular veins. The external jugular veins are formed posterior to the angle of the mandible by the union of the retromandibular and posterior auricular veins. Once the external jugular veins are formed, they pass straight down the neck in the superficial fascia and lies superficial to the sternomastoid muscle throughout its course, then reaching the lower part of the neck, where the external jugular veins pierce the investing layer of cervical fascia to enter the subclavian vein. The tributaries of the external jugular vein include posterior external jugular, transverse cervical, and suprascapular veins. The anterior jugular veins are variable and inconstant. They drain the anterior aspect of the neck. These bird venous channels begin as a small veins that come together superior to the hyoid bone, as we see. Often the right and left anterior jugular veins communicate with each other and connected by a jugular venous arch in the suprasternal notch. Thank you.